guys, thanks for tuning in. I'm here with Natasha. She comes to clinic today with complaints of redundant or crepey upper eyelid skin. And she doesn't have a very well-defined crease, so today we're going to do upper eyelid surgery to lift that part of her upper eyelid, to redefine that crease and just give her a little bit more rested look. Fortunately, she has eyebrows that are nicely positioned. We sometimes see droopy eyebrows as part of this constellation of the droopy eyelids, but her eyelids are in a nice position. And so we're just going to treat the upper eyelid skin today. Some of the fat around the upper eyelids as well, we're going to address that. And again, just do this to give her a more rested and better definition to the crease in the eyelid. Just looking straight ahead, and I'm going to use this as a pointer. You can see that the brow here is above. I'm putting my finger here on the rim, the top of her eye socket. Her brow is nicely positioned above that. But you see here that there's some redundant skin. When she close your eyes there for me, Natasha, there you go. And I'm just going to pinch this loosely. Some of this extra skin here is redundant. I can pinch that and pull it out, and it's not even raising her eyebrows. So this is just associated with aging, and we're going to make some marks to get rid of this. She also has a little bit of extra fat right here and in this part of the eyelid that, again, makes her look a little bit tired. We're going to address that too today. So we're finished here. We just did exactly what we set out to do, which is to put this incision right in the lash line, right in the crease. We took a little bit more off the right side than on the left. Of course, she had a little bit more extra on the right side than on the left. And of course, you saw us taking out the fat immediately here and here. It's just a little bit swollen right now because we just finished, but you won't really see the results from that until the swelling goes down. But that should give a really nice effect and a really well-defined crease. We'll see you back in a week to get the stitches out, and we'll see you back further out to make sure we like the outcome. So thanks again for tuning in. We're back with Natasha, and she's 8 weeks after her upper eyelid surgery. This is called an upper blepharoplasty. And in her case, she had some extra skin. She had a little bit of fat in the upper eyelid, which we removed as well. And now she has a very nicely defined crease. She's 8 weeks post-op, so we're going to do an exam today, judge our outcomes, look at the scars and the position of her brow. Interestingly, or not so much, but when I go to examine someone's eyelids, I rarely examine the eyelids in isolation. Although we just did an upper eyelid surgery in Natasha, I think of eyelids as part of the periorbita, and the periorbita includes the brow, the position of the brow, the upper eyelids, and the lower eyelids. And it's very difficult to isolate these because almost always we think of these anatomic areas in context and in association with each other. In her case, she just had some extra skin on the upper eyelids, a little bit of fat on the upper eyelids. Her brow was actually in good position, and her lower eyelids look great. So we did an upper blepharoplasty. And as an isolated procedure, we did hers under local anesthesia, which you can comfortably do with some oral sedation or without oral sedation, but in an office setting. Her brow has always been nice and smooth, and the eyebrow has a nice arch to it, and it's actually about almost a centimeter above the rim right here. This point right here is the top of her bony orbit. That's to say the bone, the upper part of the eye socket. Crease now is well defined, and if you close your eyes for me, Natasha, these scars are really difficult to perceive. I mean, they're hidden very nicely in that crease. Open your eyes. All right, very good. And conceal really nicely. So I think that's a really nice result. I'm happy with the outcome. And so we've also corrected for some asymmetry here. You can see that in the after pictures. And thanks again for tuning in.